I'm John Despott and I'm a consultant gastroenterologist and an intervention endoscopist. I lead the endoscopy unit at Royal Free Hospital on the NHS, but in the private sector I work here at the Wellington Hospital. I've really dedicated my entire career to advanced endoscopy. I've done fellowships and I've also gone many a time to get trained by the Japanese masters. My mentor is Professor Hironori Yamamoto, who invented double balloon enteroscopy, is always the special star, the special guest star at our Advanced Endoscopy Masterclass, which we hold every year in September in London at the Royal Society of Medicine. Double balloon enteroscopy. This is a very specialized technique that allows us to look at the whole of the small bowel, but not just look. We can take biopsies, we can apply therapy. I've also focused on endoscopic submucosal dissection, which is a technique that was also developed in Japan initially by Professor Yamamoto and then other colleagues. And it allows us to remove suspicious lesions in one piece, unblock.
I'm Xavier Galang. I'm the Senior Endoscopy Lead Nurse at the Wellington Hospital Endoscopy. As an endoscopy nurse, we facilitate the patient's full pathway from admission to discharge. When you have the procedure, our endoscopy nurses will also assist the doctor, ensure that you are comfortable with the procedure, whether you're having a gastroscopy or a colonoscopy, double balloon enteroscopy. We will be able to guide you through as the procedure goes along.
We're very excited that we've launched a new service here at the Wellington. So what is double balloon enteroscopy? It essentially is a type of technique that allows us to scope the whole of the small bowel. So what's so special about the small bowel? It's a very important organ which allows us to absorb and digest nutrients. For that purpose, it is extremely long, but the small bowel, although excellent in its function and design, is if we try to pass an instrument into the small bowel, it being a very long and floppy tube, you just cause looping, you just cause it to stretch and you don't get very far. So until the advent of double balloon enteroscopy and capsule endoscopy, the small bowel was the unknown for endoscopists. Professor Hironori Yamamoto came up with the idea of double balloon enteroscopy. And it is a simple but genius idea, because using a system of two balloons attached to the tip of a long instrument called an enteroscope and the overtube that runs on the enteroscope, by inflating these balloons, we are able to grip the small bowel and control its movement, preventing it from stretching, and with sequential deflations and deflations we're able to practically walk down the whole of the small bowel. And the way it does this, if I were to borrow from an analogy in common practice in life, imagine you've got a bucket that has lost its handle and you need to lift this bucket. One way of doing it would be to inflate a party balloon inside this bucket, and as soon as the party balloon inflates enough, the balloon butts onto the walls of the bucket, you're able to actually use the balloon to lift the bucket. And like so, in a similar fashion, when the balloons are inflated, we are able to gently grip the small bowel walls and manipulate it and prevent it from stretching. Genius. But double balloon enteroscopy is respected as the gold standard. The reason for that is that it's been around for the longest period of time, and it's time tested and proven to be safe, effective, and for these reasons here to stay. It's certainly going to keep on helping our patients to avoid surgery if that can be avoided, and it allows us to treat several conditions which would otherwise lead to hospital admissions and more invasive care. So it really has revolutionized the way we practice this specialty.